My name is Clay Williams, and this is People Talks, presented by Canal Pursuit Productions. The idea behind People Talks is that everyone has a story, and everyone's story has value. People Talks is a mixture of people with lived experience and people who work in health and fitness fields. Our guest today is Dr. Tina Rogers. Dr. Rogers' connection with her patients is strong. She enjoys educating and giving her patients the tools they need to heal themselves. She's found that when the root cause of disease is discovered, it can be life-changing. Known for being empathetic, caring, and positive, Tina's areas of focus in naturopathic medicine are gut and hormone health. So with that, welcome to People Talks.
Hi, thanks.
Yeah, I'm so glad you're able to join me tonight. I'll start off, I guess, with, well, this sounds kind of weird, how we met. So, because it really addresses one of the points in your introduction. Back a few years ago, I guess, probably 2018 or so, it was recommended that I come and see you, as chronic arthritis was a thing that just wasn't being addressed, and we worked on a root cause together and found it, and I've been mostly free of arthritis pain and swelling. So the full range of motion back and all of that stuff. And it was an interesting journey to go through some of the potential problems and honing in on one or two specific things that were the root cause. And that sort of investigative approach makes me think that maybe when you were younger, you were a fan of Sherlock Holmes or something like that. What got you into naturopathic medicine? Was there a single thing, or how did that kind of develop?
It's an interesting story. Speaking of childhood, I was always interested in helping other people. And I remember as a young girl, trying to make potions with different flowers in my mother's garden. So I have always had a connection to nature. And then growing up, I was a competitive swimmer, and I went to school in the States, and I had injured my shoulder, just swimming too frequently. And I had applied to medical school, but my MCAT scores weren't high enough. And so I came home and I thought, what am I going to do? And I had this shoulder pain, and my cousin was actually in school to be a naturopathic doctor. And she said, hey, why don't you check out naturopathy? And so I started to investigate, and I thought, this is quite interesting, because instead of just saying, oh, you have shoulder pain, well, why do you have that shoulder pain, right? And getting to the root cause. And so then I started my journey as becoming a naturopath.
Yeah. So what, explain to us lay people, what is your training, and what is your kind of area of expertise? I think a lot of people might not know the full scope of what you know and what you do, right?
Yeah. So to become a naturopathic doctor, you need to have an undergraduate degree, generally in health sciences. So basically the similar courses you would need to apply to medical school. And after that, you have 4 years of training. In Canada, there's 2 schools, one in Ontario, which I went to, called CCNM, and the other one is called, it's not, I think it's Bastier. It's out in BC. So those are the schools. And then it's another 4 years. And during that time, you're taught about different diseases and how to diagnose and how to read lab tests and whatnot. But then you're also taught about botanicals, so different herbs, nutrition, acupuncture, traditional Chinese medicine. So that's your 3 years. And after that, then you do a clinical year, and you treat for the year while still taking courses.
Okay.
Yeah. And then we're regulated by the College of Naturopaths of Ontario. So we have a regulatory board as well.
Okay. Okay. How many naturopaths in Ontario, roughly?
I don't even.
Yeah, well, you're the only one I know.
I'm not. There's plenty. I'm pretty sure.
Come on, I should have warned you. I was going to ask that question, right?
Yeah, I can't off my head.
So you've been doing this for how long?
Um, as of May, 13 years,
Oh, okay. Wow.
long time.
So so you do not just consultations and dietary recommendations, but other treatments as well, right?
Mhm. Yeah.
Such as?
Such as treatment wise, I currently do a lot of acupuncture.
Okay.
That's one of the big things that I like to do on the side. And then one of the clinics I work at in Uptown Waterloo also offers IV treatment. So sometimes I'll refer over for IVs for
Okay.
patients and ozone therapy as well.
Mhm. Okay.
Yeah.
Okay. Yeah. One of the
Mhm.
things that made me want to get in touch with you for People Talks is the recent promo that you sent for the Grief Unlimited, or Grief Untethered
Mhm.
support group program that's coming up here shortly, and
Mhm.
the other I want to use the
Embodied,
word not recovery. What was it?
embodied,
Yeah,
stress.
that was a little earlier on, and kind of makes me think we're sort of on the same page when talking about mental health and the mind body connection. Is there how does that mind body connection, how is that addressed in naturopathic medicine? Like, is that kind of part of your of your personal life, or is that part of the training?
Well, so there's two parts to that story. So one,
Okay.
I have a friend who is a psychotherapist,
Okay.
and we offer retreats fairly often throughout the year. Generally, they are for stress and anxiety
Okay.
because that's prominent in practice. As a naturopath, we are taught a lot about mind-body connection and psychology. However, I would say my friend is more suited to that part, and so that's a big part of what she does in the retreat.
Mhm.
But naturopath too is understanding how stress impacts our body, right? And it changes certain
Mhm.
inflammatory markers, but also changes like our inflammation in the body in terms of gut health. And then gut health can change, which in turn changes our mental health, right?
Right.
So it's all connected. Um, and oftentimes when I talk about two patients, they might come in with something like IBS and anxiety. And then when we talk about stress, well, they're really stressed out, right? And so when they're stressed out, it's changing inflammation, it's changing how you can process nutrients. Then that changes the gut microbiome, which then upregulates certain hormones in your brain. And
Mhm.
it's all
Mhm.
interconnected. So if you don't address one, you're not going to fix the other. And if you don't address the other, you're not going to fix one. So it's
Right.
all did that way.
We're so complicated.
We are really
We
complicated,
are.
but amazing.
So I started, I remember when I was in high school and I chose engineering because I was good at math, and math gave absolute answers. High school math gave absolute answers. Um, didn't deal with imaginary numbers yet. So I was really comfortable in going into engineering because I was going to be able to apply specific laws and get specific results. But the more engineering knowledge I gained, the more variables came into the picture, and yeah, everything's complicated.
Complicated. There's not a simple
Oh,
answer.
no, no. Um, so how is how has your I'd like to say we're out of the pandemic
Mhm.
mostly.
Mostly.
We're not out of the results of the pandemic yet, but how has the pandemic, do you think, affected, let's say, two things: your practice and your patients as kind of separate? Have you seen any kind of sort of trend of things get moving one way or another?
Very interesting. Um, I think that what I've seen this year is a lot of patients wanting to come in person.
Hmm.
Um, a lot of people were doing Zoom or doing video conferencing, which can be helpful in terms of like, hey, if you're out in Toronto and I'm in Kitchener, that is a solution. But I think people, what I've seen in my practice and what I enjoy too is just human interaction, right? Like face talking, which I think we're missing a lot of it, especially the pandemic came about.
Yeah, for sure. I think I've seen that in the running community as well. A lot of people are looking for someone to run with, or a little group to run with, and get back into some social interaction again, right?
And then the other thing that I've seen now, especially since we've been running these retreats, is how working in community can be very, very healing. And some when you're online or you're at home all the time, you don't realize that other people are going through the same things that you are going through. And oftentimes sharing your story and having someone witness your story is healing in itself. And it's been a big part of the retreats and healing and helping support one another and making connection again, because it's been something that's been lost.
Yeah, I think there's well, I suppose history will tell in 10 or 15 years, but I think there's the pandemic has had some dire effects and will have some dire consequences on people for a while. We may be out of the severe disease stage of the thing, but the effects of that, of all the things, and there were lots of things. Yeah, this the polarizing mentality and the isolation and all of that is going to take a while to heal from, I think, right?
And the one thing that really also came up, because you said a change in my patients, was a lot of mental health issues are being more for me. A lot of depression, however, a lot of anxiety, and a lot of it not only in adults, but mainly in kids and teenagers. That's a big part of what I'm seeing in my practice now too.
Yeah. The pandemic created a lot of uncertainty, but I think the youth are seeing the effects of climate change as being severe in their lifetime, right? Where the generation before me, it was hundreds of years away before there's going to be some disaster. So I think the youth are seeing that we really have to do something now. So the location of your practice, you've had a couple changes in the past 5 years or so, right?
I have. Just with the pandemic hitting, changing locations, and then just things not working out the way I wanted to. I changed locations again. So now I'm working at 2 locations, one in Kitchener called Savannah Massage Therapy Clinic. The other location is called Functional Medicine Uptown Waterloo, which is just across from like Father Bauer David Drive, near Urban. Yeah, those are the places I'm out of. So I have lots of patients in Waterloo that are happy, and lots of patients in Kitchener that are happy that I'm not part of.
Mind-body connection is often something that that I talk a little bit more with about, with the guests, because I've talked to psychotherapists and counselors, and and some mental health advocates for sure. Not many traditional medicine practitioners, but the traditional medical model is a physical health care system and facility, and a separate mental health care system and facility, right? And I think talking about through the pandemic, more people talking about mental health concerns, that may be 2 things, right? I think in the past 5 years, we've probably seen a lot of the stigma around mental health issues kind of dissolving away or going a little bit into the background. So more people are less uncomfortable talking about it. So I think we're seeing a little bit more because people are talking about it when maybe before they wouldn't have. But that's not to say it's not getting worse, right? During the pandemic, I think it's a good thing that naturopathic medicine understands the full complexity of this human thing that we are, right? So there's, as you said, there's a little bit of, not a little bit, there's an awareness of the connection between mental and physical health. Is it of people practicing naturopathic medicine? Are there people that are more involved in one specific area than another? Like you were saying that you kind of specialize in gut and hormone health. Are there specialties like medical doctors with a specialty in heart or that sort of thing?
I would say there's more of a focus, right?
Okay.
So instead of a specialty. So, I might invest more time in researching about how certain bacteria influences dopamine or serotonin production in the brain. Whereas, another friend of mine who really enjoys fertility will look at more how, the gut might impact, progesterone and estrogen, right? Or what those. So it's almost like what I found is, what do you find interesting, right? Or more so is, who are the patients that are coming to me, right? That's how I've driven my practice, is that I noticed that, hey, all of a sudden this influx of patients is coming to see me particularly. And so I'm going to invest a little bit more time because I find it very interesting. And because of my own story, right? Being a competitive athlete and being a runner, I ended up having a lot of gut health issues. And that it was part of the problem. And even more so, I think about being a road runner converting into a trail runner, and how my ankle enjoyed the trail a bit. And when you think about mind body, is it also because when you run in the trail, you're more free and you're more calm and you're less stressed? And maybe that's and decreasing the inflammation. And that's why my ankle's feeling a lot better. So that's mind body connection as well.
Yeah, for sure. Yeah. And that's that the running mental health, or let's say physical activity mental health connection as well, right? Yeah.
Movement's key.
Yeah, absolutely. 20 minutes a day, or like an hour, maybe an hour is better.
Sometimes
or 5 hours on a Saturday, or
get out.
So are you in any you still swimming?
I am not swimming right now.
Oh yeah.
No, I'm just running on the trails right now.
Okay.
Yeah.
Have you done any races? Are you interested in races? Is that a thing for you, or?
I am doing a race. I'm doing a very big race. I'm doing Quebec Mega Trail 55 kilometer.
No way.
That's in July.
Whereabouts is that?
Mount St. Anne.
Okay.
Yeah. So that's one of my biggest preps, and it's more of a journey rather than a race for me.
Yeah, I think I've done a few races over the years, and I think my view on races has changed over the years. And I'll have one race this summer. I'm focusing on a 100-miler that I want to try and do in less than 24 hours. So that's my competitive thing. But the other ones, the other races that I'm doing are running with friends and running in a new venue, and the adventure part of it, right?
Which is pretty amazing.
Yeah, absolutely. There's a good running community. I guess guys that ride bicycles say there's a good bicycle community, but I think the running community has been really welcoming, and a lot of people can say that, I think.
Absolutely.
was there kind of something, so a lot of the guests I've talked with
Mhm.
as counselors have had a something that's driven them to pursue that, right? And I think you kind of addressed that with your love of nature and making potions when you were a kid.
I
That's one of the coolest things I've heard in a long time.
Yeah,
um, what did that look
it's
like when you were a kid?
just picking flowers and exploring. But you know what, I would say the most interesting thing for me is because I've changed a lot as a naturopath over the last 13 years.
Mhm,
Um, and I would have, when I first graduated, I would have always said it must be evidence-based medicine. Like everything has to have proof.
mhm,
And learned that that's not necessarily true.
mhm,
And so, you know, looking at different things can heal someone just as much as taking, this medication or this certain herb or this certain diet, and more leaning more into, meditation and
mhm,
calm and the energy of the whole universe and how that can actually impact our body just as much. And
mhm,
I think that's one of the things that I've noticed with the pandemic are people are becoming more open, right? Instead of being closed-minded
mhm.
to things, right? So just because, hey, there's really not a huge base of evidence saying that meditation will, you know, decrease CRP, which is an inflammatory marker in the brain, doesn't mean it actually won't do that, right? And
Mhm,
I'm starting to learn more a balance of that, or even looking at Reiki, right? There's a ton of
mhm,
my patients who like Reiki, and I did my Reiki training because I had Reiki done on me, and I
mhm,
after the Reiki had happened, I thought, holy smokes, I feel different. And then we offered Reiki at one of our retreats, and we had several of the people reach out to us to say that it was life changing. So
mhm,
just because it's not always a measurable variable doesn't mean that something like that doesn't work, right?
mhm,
So
mhm.
that's kind of things that I've noticed in myself that I've changed is I'm not always like, oh, it has to have evidence and it has to have proof. There's things that work out there and we don't know why, but we know
Mhm.
that they're cool, and why not do them, right?
Right. Yeah,
Mm.
for sure. We're we're pretty complicated, and we we don't know all of the connections, right?
Mhm.
Um, I was curious about um, naturopathic medicine as opposed to what we pick up in the pharmacy, and
Mhm.
what's the viewpoint, or what's your thought process when you see someone with a swollen knee that's painful? You go to a painkiller, right? Or how does that work?
Yeah. I love, or my people that go on Google. That's always my favorite too. Oh,
Yeah.
and this and this and um usually always I'm gonna try to figure out why.
Hmm.
Why is it happening? Right. So for instance, let's just say I myself am celiac, right?
Hmm.
And
Okay.
I have gluten. I don't necessarily get GI disturbances. I get joint pain.
Mm,
Every
okay.
get canker sores
Mm,
in my mouth. And so someone who comes with a swollen knee, let's say they don't, if they have a torn ACL, well, hey, that's why they have a swollen knee.
right.
But don't have an injury to it and it's just bugging you. Well, what is causing the inflammation, right? Maybe you do have celiac disease because 25% of people who have celiac don't have GI disturbances. So you
Hmm.
might be that 5% person that doesn't. Maybe you have some dysbiosis, so you have some really bad gut bacteria, and you're not absorbing any of your nutrients. So I might look at that marker as well, and and then kind of rule and tease things out. But then I also in that term, so that let's say gluten's your issue, so we take gluten out, the knee feels better. but what else can we do naturally too, right? So we might add some turmeric into your diet, and we might add some omega-3s, right? Good for inflammation, or, it might also just be someone who's really low in vitamin D. So that's a big one. And the other thing that I see a lot in practice is actually anxiety and stress, right? And oftentimes we'll do some blood panels to see, what micronutrients might be deficient. And oftentimes people who are very low in vitamin D end up having anxiety because you need vitamin D to make dopamine and serotonin. So you're not going to feel your vitamin D is low, or they actually are very low in B12. And B12 also is a marker to help increase serotonin and dopamine in your body. And so low, you're going to have persistent symptoms of anxiety. And so then our other part is, okay, they're low in this, but why are they low in this, right? So how do we help them get B12 in their diet and make sure that we figure out why it's being depleted and fix.
Right. Yeah. So right from the onset, be aware of the symptoms, but don't just treat the symptoms. Go for the root cause, like right away.
Yeah. Because if you take an ad, over time, your stomach's not going to like you. Your stomach, and then you have a new set of problems.
Well, yeah, and you masking the symptoms doesn't help to find out what's causing them, right?
There's a time and place for NSAIDs for sure, but chronic use is definitely not what we want to do.
For sure. Is there anything that you wanted to talk about?
Me?
Specifically?
Oh, geez. I think the big thing that I'd like to talk about is, and I think a lot of people don't think about it, is stress, right? And not only mental stress, because some people have more mental stress and some people can cope with mental stress better. But I think a lot of us don't think about stress as a physiological response, which is a fight or flight response, right? Versus our parasympathetic, which is rest and digest. And being in the society that we are, where we're on cell phones and we're on computers, we're always on the go. So we're go, 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 go all the time, which is also really high stress, right? And have that balance between that go, 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 and just taking a minute to sit down, be calm. And something I talk about all the time in practice, because I'll say, well, what's your stress like? And someone will say, well, I'm not stressed out. So like 4 out of 10, 10's the worst. And then I said, well, are you on the go all the time? Yeah, I'm on the go all the time. Right. So then we always implement, take 10 minutes to just go for a walk outside, connect with the earth, take 10 minutes to breathe, take 10 minutes to read, because as we de-stress, it changes a whole bunch of biochemicals in our bodies. And that in itself can help us heal very easily, and can be a compounding factor that doesn't allow us to heal. So that's one thing, is taking some time to just decompress, be calm, and take some time for yourself, because a lot of people don't do that.
Yeah, and that can result in a catastrophe. I've talked to a couple of people who have had an unexpected breakdown, was standing in the driveway and passed out. And it was a result of just the nonstop for days and months at a time, right?
Yeah, and there's a lot happening.
What's that?
There's a lot of burnout happening.
For sure. Yeah, I've thought for a long time about myself. So talking about stress and so on, I know that I thrive on stress, but a certain level of stress. And I think I've been in situations where those stress levels are far beyond manageable. And I think it's important that we recognize, that we try to recognize that before it gets to that obviously unmanageable level, right? Because it can be harmful even before that. And if it's a long simmer in stress, and it's kind of a self-imposed thing too. And there's definitely an option to take those 10 minutes and breathe. After the alarm goes off in the morning, don't turn on a screen for 10 minutes.
Just
Yeah. Yeah.
Absolutely.
Yeah. Yeah. That's good. That's good medical advice. Think
Yeah.
about stress.
Think about impact your whole body
Yeah.
is what I
So you've got a race coming up, just the one race.
have several races, but that's my
So that's the A one, right?
that's the A race.
I did a lot of trail running up until 2014. And then in 2015, I did the first canal pursuit. I ran, it was almost all roads from Port Severn to Ottawa. And I really love running on the road now. It's
There you go.
way less likely to trip and fall down. And at 62 years old, falling down really hurts.
That's true news.
That's a problem.
That is a problem.
Yeah. I think we've covered just about everything that I
Yeah.
kind of wanted to talk about. I'll cut it off here. I'll do the clip thing. And thank you so much for joining me. And on kind of short notice, I contacted you, I think, last week and said, hey, let's set this up. So yeah, it was a pleasure learning a little bit more about the kind of work you're doing. I really like the approach of naturopathic medicine of finding that root cause and yeah, investigating and I know from firsthand experience it has been life-changing for me.
Yeah, I would agree. Love it too. I love helping people.
All right.
Absolutely.
Thanks very much.
You're welcome.